consultant knee surgeon. Over the last decade, I've had the privilege of treating thousands of patients non-surgically, and I've been able to fix and help cartilage, bone, tendon, meniscus, and muscle heal. And I can tell you the single most important factor to getting your knee better isn't injection therapy. It's not nutrition or supplements. It's not even surgery. It's muscle. And I want to tell you all about muscle in this next video and what you need to do, which is strengthen it to help you get back to full fitness and become pain-free. Welcome, I'm Dr. Arj. I'm a consultant knee and hip surgeon in London. My main clinic is at Lanserhof in Mayfair. In the clinic, we practice something called OrthoLongevity, which is where we combine orthopaedic surgery and orthopedic medicine with longevity and functional medicine. We use something helpfully called the repair system to help you get back to full fitness, which is a multidisciplinary system that uses all the best principles of physiotherapy, osteopathy, nutrition, strength and conditioning, and anti-inflammatory and biological treatments, all wrapped into one protocol designed specifically for you or personalized for you as an individual patient, because different treatments don't always suit different people. And I've recognized that over the years, and we've perfected something that we think will help each person. So just to be clear, the standard disclaimer is that this isn't personalized medical advice. This is a video for general education, which is something I'm really keen on. And it's important that you speak to your local qualified healthcare practitioner who can assess you properly and then give you the treatment that you need. So just briefly, I want to explain, if you don't already know, why longevity and OrthoLongevity in particular is really important to me. At the time of filming, I'm going to be 49 next month, and I have 4 children, 2 of which are newborn. He's only a month old, and I also have a 2.5-year-old. And so being at home is pretty fun and full on. I also have 2 cats and a dog, so there's never a quiet time. My third daughter, Coralie, was born with significant health issues, and she was extremely premature, and unfortunately was in hospital for over 5 months and had to have 4 major life-threatening surgeries, all of which she's now recovered from. But watching her fight for survival really had a big impact on me, how I viewed my health as someone that's getting older, and how I realised many of us are fortunate enough to have the use of all of our limbs, and how we have it within ourselves to control how we age and how long we can stay independent and strong for, to help others. So longevity medicine stopped being theoretical. It became part of my new life. So it's been really difficult, and I still struggle every day, but I committed to losing weight, getting strong, getting better posture and stability. And in 2024, as part of charity, the London Marathon, not particularly fast, but I finished it, and I hadn't run before that more than about 5 kilometers. I trained as someone in their late 40s, injury-free, without any aches and pains, because I followed my own principles. And I also managed to lose over 20 kilos, and I've still kept it off, though it is difficult, especially with Christmas coming around the corner. That's why I want you to know that I don't ever ask patients to do something that I'm not prepared to do myself, or that I don't personally believe in. So being based at the Lanserhof Clinic in Mayfair is really unique at the moment, because I get to work as part of a multidisciplinary team full of all the types of clinicians that may treat you if you have pain in your joints, such as your knees and hips. This means that as an orthopedic surgeon, I now don't see patients as an isolated knee or hip, but as a full person. Strength and power and muscle are all linked, and it's muscle that we're going to talk about today. So how does muscle actually work, and what is it? Most people think that muscles just move the body, but muscles do far more than that. They protect your joints, they absorb impact, and they help keep the joints stable, and otherwise they may be unstable. Think of your muscles like a really strong elastic band. It can work in 3 ways. Firstly, it can shorten, which is called concentric. So that might be my bicep. When I bring my forearm up and do a bicep curl, the muscle here is shortening. That's concentric. Second, it can lengthen, and that might be when you're lowering yourself down into a chair, your thigh muscle will lengthen under tension. So that's eccentric. Slow lengthening like that is great and builds strength, especially in the tendon. And that's one of the treatments we would use for tendon pain or tendinopathy. And thirdly, the muscle can stay the same length but contract. It doesn't lengthen, it doesn't shorten. That's called isometric. That might be doing something like a wall squat, where you put your back against a wall and then lower yourself down a little bit so your knees bend and you hold that position, or maybe holding something like a plank so your muscles are contracted but they're neither lengthening nor shortening. There are two main types of muscle fibers for you to know about. Type 1 muscle fibers are for endurance. Type 2 muscle fibers are strength fibers. It's the type 2 fibers that I'm more interested in to help protect your joint. They shrink, unfortunately, as we age, and shrinking muscle or decreased bulk of muscle is an important term that's called sarcopenia. And we want to really prevent sarcopenia or reduction in muscle strength and bulk as we age. And to do that, we need to get involved with strength training. And strength training really has to be, as far as I'm concerned, for good. You've got to try and do it forever, and you've got to make it an easy part of your week. I would only ask that you do it for 1 hour once a week as a minimum. Of course, if you think you can do it more, that's great. But 1 hour once a week is going to give you massive gains as the years go on. So why does strength training or muscle reduce knee pain? Most knee pain is due to overload, pressure inside the knee, in particular on some of the structures in the knee, like the lining, the synovial lining, the ligaments, tendons, the meniscus, and also the bone just under the cartilage. Pain increases when the load on your joint exceeds the capacity of the joint. So where does the capacity come from? It comes from muscle strength, movement control, or stability, which is so important. So there's strength and there's stability, and they're different. How healthy your tissues are in terms of, do they have a disease process going on in them, or are they just chronically inflamed, or are they healthy? And what's your recovery biology like? Are you in a state where your body can heal well? Do you have good nutrition? Have you had lots of sleep? Have you got good stress levels? Are you able to mend properly? Do you have any disease processes that may reduce that or make that less successful? Here's something really important that lots of people, and sometimes even healthcare professionals, don't understand. Cartilage in your knee or cartilage in your joint does not feel pain. There are no nerve endings in cartilage. So when you have damaged cartilage, pain comes from the surrounding tissues in the joint, not the cartilage directly. It may come from the bone underneath the cartilage, which has nerve endings and are very sensitive to pressure. It may come from nerve endings to the lining of the knee joint called the synovial lining, which is like the inner skin of your knee, I guess. It can also come from adjacent structures such as ligaments and tendons, which are things that either hold the bones together, so that's ligaments, or tendons are things that attach muscle to the bone. When the load is too high, the mechanical stresses in the joint are too high for the joint to cope with, and then you get a release of proteins from cells in your joint. These proteins are called inflammatory mediators, and they cause you to be more susceptible to pain or to feel pain more. They cause the joint often to swell up and it becomes more tender, and you actually get a vicious cycle or a cascade, and then more proteins are released. And some of these can also damage some of the cartilage to make things even worse, so the joint then cannot cope with more load, and on it goes. So pain in your knee can actually fluctuate. It's not always related to what your x-rays or MRI scan look like, because it depends mainly on how much inflammation is in your knee and how irritated your knee is. If you can reset it and help with anti-inflammatory proteins to get into the knee, that can help with mending part of the knee or reducing breakdown of the knee, and also help with how sensitive your knee might feel and bring swelling and swollen tissues down, then your knee can feel a lot better, even though you may still have the same MRI scan or x-rays you did 3 months ago. So the OrthoLongevity method that I promote is really important because it breaks this cycle by trying to get your capacity early. Important to remember, your knee hurts not because it's broken, because there's too much damage, but because it's overloaded, and our job is to help rebuild its capacity to handle load safely. So the stronger and more stable your knee is, the less likely it's going to hold you back and stop you doing all those things you enjoy. So in terms of training, what type of training do you do? What are the different types? So there's hypertrophy, which means increase the size of your muscles. Normally to do this, you might do in the gym a lower number of an exercise, but at a slightly higher resistance. So classically, we'd call that 4 to 6 reps. So if you were doing an exercise to strengthen your biceps, you would curl up with a weight that's heavy enough that doing 4, 5, or 6 is quite difficult. If you were able to curl like 12 or 15 times, it's probably too light to do hypertrophy. You then have a break. I normally have a break for about 1 minute. That's normally because my schedule is tight. I only get to the gym on a Friday afternoon normally, and I can be in and out within an hour. I think if you've got more time, that's better. You can rest up to about 2 minutes, and then you go again with another 4 to 6 reps. you have another 2-minute break, and then you go again for your third set. Again, if you've got time, you can do a fourth set, but I can only manage 3. If you were going to do more endurance training, then you do slightly lighter weights and higher reps. So again, if I was trying to make my bicep muscle to have more endurance, then I would aim for the 8 to 12 rep mark. So 8 to 12 of the exercise at a slightly lighter weight, so I could actually do that. And again, I normally do about 3 sets, and that will help the different fibers in your muscle, help you have more stamina. But for helping your joint initially, you need strength first. You can concentrate on stamina later. So for now, I'd say forget stamina, go for strength. The other thing that trainers sometimes talk about, whether they're strength and conditioning coaches or personal trainers, is zone 2 cardio workout. So zone 2 is where you're doing an exercise or an activity, but you're still able to talk in full sentences. It sometimes equates to a certain heart rate, which is a rough way of doing it. But I'd say if your heart rate is around 100 or a little bit less or a tiny bit above, that's normally zone 2. That's really important because there's something called mitochondria, and you may have heard of mitochondria, live inside all your cells. They are the powerhouses of the cells, and they convert various proteins into energy using oxygen. Zone 2 training has been linked to improving the health and function of the mitochondria. When they work well, your inflammation is lower and you have more energy. Also, your pain sensitivity reduces. So we aim for zone 2 training and also strength training for hypertrophy to build up the muscle size. So should you lift heavier? The short answer is yes. But if you lift too heavy, your pain can flare up, and it's important when you train. Pain sometimes is there and it can be managed or ignored, in my opinion, as long as the pain score is lower than 4 out of 10. So if 10 out of 10 pain for you is the worst pain you've ever felt, and 0 out of 10 is no pain, I would say if you're around a 4 or a 3 or a 2 or 1, you're okay to train. Just got to be sensible. If the pain starts to get worse, you may have to dial it back, have some rest, take some anti-inflammatories if you're able, and go lighter so your body can adapt. Otherwise, if you can train through a little bit of discomfort, normally your body will adapt, your muscles will grow, your bone will get more dense. And actually, when you come back the next time, you'll be able to improve and lift heavier. It's important that you understand you're normally not making damage worse by doing strength training, as long as you've had, I would say, someone professional and qualified assess you to make sure you don't have some actual torn or acutely damaged structure in the knee. The safest way would be to get an assessment, sometimes even get an MRI scan. But if it's a dull ache or some dull pain that you get, or stiffness and occasional swelling, you're okay to train through it. That's how you get fitter. If you don't train and you retreat from your training, you're not going to get fitter or stronger. And sometimes it seems like rest helps, but actually rest just helps for a bit. You'll find that as you lose your fitness, you start to get that pain in more normal activities, just walking, lying in bed. So the best thing is to train through if you're able, and to understand that what you're doing is not damaging your knee more in most general cases. When we talk about how much weight should you apply, especially if you're a novice in the gym, there isn't a right answer. We're all totally different. So the weight I might use for my leg muscles or my hip abductors as I'm pushing my legs out against resistance, which is a great exercise, might be totally different to you and the next person. The key is to aim for about 4 to 6 reps, and the last rep should be quite challenging or difficult to do more. That's the correct weight. What I do is I tend to use an app. There's lots of apps out there. I used to years ago just use a pad and a pen actually. You want to write down what the weight is for each of the exercise machines you're on. So next week when you come back, or in a few days when you come back, you know what weight you're on and you can log it and see if you can stay the same or if you can improve it. On some days, you're just not going to be feeling as good. There are some days when we just feel weaker. That's normal. Don't punish yourself. Just go with it and do it. If you can do the training, get to the gym, it's much better, even if you have a poor workout, than always trying to, do a personal best and get stronger and stronger. It doesn't always work like that, especially sometimes as we're getting older, like me. So what exercises protect the knee? So I'll go through them briefly. I tend to use something called Romanian deadlifts. That's where you bend forward slowly at the hip and you pick up some weights from the floor and then straighten your thighs and your back and lift the weight up so you hinge at the hip. That's a really good exercise for what we call the posterior chain, which is just a term for the muscles at the back of your leg. So that's your gluteus max, the big muscles in your bum, your hamstrings, which are the muscles in the back of your thigh, and also part of the calf muscles at the back of your leg. So that's a really good one to do, because that exercise of lifting something up and then popping it back on the floor tends to really help all those muscles. You just have to be really careful that your form is good so you don't hurt your back. Hamstring curls are another really good one. You tend to lie on your front and bend your knee, so you're tightening the muscles at the back of your thigh called your hamstrings. There's another machine often in the gym where you can sit on it and again pull your legs back, or you pull your ankle back to your thigh, and that again is the same exercise. And often hamstring muscles are really overlooked. We tend to work on the muscles in the front of our thigh a lot more, which are the quadriceps, but hamstrings are really important. As a rule of thumb, don't be too deflated if they're weak. They're normally about half as weak as your quadriceps, or in other words, your quadriceps are normally twice as strong as your hamstrings, so that's quite normal. Lots of people who are really fit and developed get pain sometimes because they're quads dominant or quadriceps dominant, which means they've got great quads, but their hamstrings and maybe their glutes at the back are not quite as strong, and that means they have an uneven pull on the bones in their knee, and again that can cause pain. So you don't always get pain just because you're weak or you don't work out. I see lots of athletes who do get lots of pain, and sometimes it's because structurally they're not quite even or balanced, and also with their training, again, it's a bit uneven, and that's why they get discomfort and problems. Calf raises are great also. Your calves are so important for protecting your knee, in particular when you land, like when you land from a jump, and sometimes people who don't have good calf muscles, they can sometimes tear ligaments in their knee. Even though muscles in the thigh are strong, the calf is a really good shock absorber. So I would do calf raises where you stand on tiptoe. I sometimes do a calf raise on a leg press machine. So I push the weight away on the leg press, and then I move my ankles up and down on the leg press, which is a bit like standing on tiptoes, but you're just doing it sitting down, so it's a bit safer. I tend to do something called hip thrusts with gluteus maximus, which is great. Often this machine is not always in all the gyms, so it's a bit hard to do otherwise, but you sort of lie on this machine and you push your hips forward or do a thrust or like a glute bridge. You tend to do it normally with some kind of resistance again. So doing a glute bridge on your own is, on its own, is fine because it's body weight, but it's not enough for muscle hypertrophy. So you've got to be pushing against, a bit of a heavy weight, challenging weight. So you can only do 4, 5 or 6 repetitions, 3 sets. The other muscles I do are called hip abductor and hip adductor. Those words sound the same, but in medical language, basic abduction means to push away. So you push your legs away, push them apart. So you have machines where you do that in the gym, and you have pads on the side of your thighs and you push away. It's a really important muscle. It works. It's called gluteus medius. Hugely important muscle, different to gluteus maximus, which is on the back of your hip. This is on the side. Really important muscle when you're walking or going up hills or upstairs. So really important to work that. Adduction is the other word. That means the opposite movement of bringing your legs together, your knees together, and that squeezes the inner part of your thigh or the hip adductor muscles. So again, very good to do. Often a bit weaker than your abductors, and that's normal, a bit like your hamstrings are weaker than your quadriceps, but a great one to do. And again, I definitely do that. Lastly, I always do a core workout, and for me, that's just some sort of sit-ups. Again, there's an abdominal machine that I do to sort of do crunches against resistance. And some gyms, and the one I go to has it, you do a back extension. So you're lying head down and you lift your back up, or you push your back away against resistance, and that does the muscles in the lower back. So I tend to always do a core workout, whether I'm doing an upper body day or a lower body day, as I think core stability is very important. So if you've got time after you've done your workout, or even before your workout, a little bit of zone 2 cardio is good, either on a treadmill or on a static bike or on a Stairmaster or even a cross trainer. But you don't want to work too hard. That zone 2 is the key, just to warm up and again to warm down. And again, if you've got time, stretching would be really good, just so your muscles don't tighten up or the ligaments don't tighten up. Again, to be honest, I live in the real world. I don't often have time. I'm just in and out within about 1 hour, maybe 1 hour, 10 minutes sometimes. But if you've got a bit more time, try and warm up, warm down and stretch as well, because it really help you get back to the gym either the next week or a few days later, and it will reduce your risk of injury. So what else should you do in terms of helping your training? And again, with OrthoLongevity and the repair protocol, it's really important we see everything, not in isolation, but as one whole system. So nutrition is really important. Sleep is really important, and lowering your stress levels are really important. In terms of nutrition, protein is key. If you're a meat eater, lean animal protein is probably actually the best protein in terms of the amino acids it has. If you're vegan, that's totally fine as well. You can definitely take plant-based protein, and also protein supplements if you're allowed to. in terms of protein shakes or protein bars or both. What you want to do in terms of how much, it's normally based on your body weight. Something called creatine also helps. I've started taking this. Interestingly, my son who's 17 is quite into working out. He doesn't want to take it. And you normally buy it in a packet, and you can take about 5 grams a day. I tend to take it on workout days, but it probably helps if you take it more consistently. And that's a really good supplement to help you build muscle. Hydration is really important, drinking lots of water. I tend to drink a lot of electrolyte drinks. Probably not that good to do actually if you take too much, because I'm not sweating a lot. So I think if you're sweating a lot or doing lots of endurance running or training in a hot climate and you're losing sweat, then electrolyte drinks are key. I think probably don't need to have them as much as I have been having them, so I need to watch out because I don't want my salt to be too high. But otherwise, hydration's great, water's great. If you're not keen on the taste of water, you can add in some diluting juice, which again doesn't have a negative effect as far as I'm concerned. In terms of sleep, it's really difficult sometimes to get to sleep. I always find it difficult. My mind's quite active sometimes, or I'm sometimes thinking about the next day, especially if I've got big surgeries to do. But you want to, again, use advice on getting better sleep, and that normally involves not using your mobile phone in there at least an hour before you get to bed, calming sounds, silence, and just trying to have a calm mind really, so you can get to sleep. And ideally get 7 to 8 hours a day would be amazing if you can do. It's not always easy at the moment. It's not easy for us because obviously we've got a baby and a 2.5-year-old. Stress is also key. I really changed how I work over the last few years, especially after Coralie was born, to reduce the level of stress and anxiety I felt. And it helps you sleep. It gives me some energy. So if I sleep better, then I can train in the morning as opposed to just feeling tired and not wanting to do it. It also helps you eat better, so the nutrition you put into your body is better, so less junk food, less processed food, more lean proteins, vegetables, nuts, fruit, good oils and seeds. You're more likely to eat those things and salads than if you're tired, where you often will crave processed foods or fatty foods. So all of that's really important. We'll talk about sleep and stress levels in one of my other videos. We've just touched on it for now. And in terms of getting to the gym, I just wanted to say that there are people who are really used to going to the gym, but most of my patients, and I see many patients in a week, many of them are either not super active or they're super active, but they don't like going to the gym. So they like playing lots of football or paddle or tennis or running. But it's really key that you do try and join a gym. I think these exercises, say they can be done with body weight, or you can do them at home. I don't think the resistance is enough to help you when you're trying to strengthen your legs and get hypertrophy, because our leg muscles are super strong. So it's important you find a gym. The price range can really vary. I used to belong to a very fancy gym at one point, but then I realised I wasn't really going much, and so it was kind of wasting a bit of money. And then when my son started going to the gym because he started getting fit, I went with him, much to his horror. But that gym was much, much cheaper. It's probably like a fifth or a sixth of the price, but actually it had really good equipment. It's really easy to get to, and I should just go and show up and train. So the budget can be up to you. If you want one with a really nice spa and other facilities, that's great. As long as you go. As I said, my ask is that you at least go once a week for 1 hour and build that into a habit. I tend to go on a Friday after I've got clinic at Lanserhof. I shut it in the afternoon and then go to the gym, which is on the way to my daughter's nursery. So I have to go to the gym, it's on the way, and then I pick my daughter up after. So you want to make it easy for you. And you don't need to be intimidated in the gym. The gym is now not just full of young, male, really muscly people. It's full of people of all ages, genders, and body types and fitness levels. And once you start going, you get your confidence up. You can also go with a friend or friends or a partner, or you can talk to the personal trainers there. And whenever you join a new gym, you normally get a full induction. So you get shown what all the machines do and how to use them. It's really important that you basically, to help your knees get stronger and your hips, and work or do an exercise on every single muscle in your leg. So that's your gluteus maximus, your gluteus medius, your hip adductors, your hip extensor, your quadriceps at the front of your thigh, your hamstrings at the back of your calf muscles. That would be the minimum, in your core muscles if you've got time. So that's the end of the video. I know it's lots of information. I hope you found it useful. If you did, do let me know. I'm going to make more of these because I'm really enjoying making these videos. So I'll see you soon for the next one.